Hello, my name is Dr. Jackie Agrari-Sabet, and I am a board-certified allergist immunologist in the Metro Washington, D.C. area. I am also the medical director for telemedicine for the Allergy and Asthma Network. Today, we're going to talk about notes for parents about allergies and asthma and back to school. And I know some of you feel like you just got out of school, but we need to talk about back to school, particularly this year in 2020, because of all I think it's going to entail. Let's get started, particularly for parents that have asthmatic children. There's two types of asthma, one that's known as quiet asthma and one that's known as noisy asthma. What that really means is there's the asthma that you as a parent can actually hear, and your student can hear as well, your child can hear as well, that there's that inflammation and that swelling, and the student actually feels the tightness and makes that whistly sound that's going through their airway. The other type of asthma is that quiet asthma. And that quiet asthma is there all the time. What I mean by that is there's that little bit of swelling that's in the airways all the time, and your student may not notice it, your child may not notice it because it's a constant state of being. What I want to remind you of is how common asthma really is, particularly in the school age group. And I want to remind you that the trigger for asthma is so often allergy in the overall pediatric age group. It is the #1 reason why kids miss school. And to tell you the truth, it's one of the reasons why parents have to miss work because their kids are out of school. So let's try to address that for this summer so we're really ready for when we go back to school. The #1 thing we always talk about as doctors to patients is that we should do all the prevention that we can. And in terms of that prevention, know what your asthma triggers are and then just avoid them. And please, if you're having frequent symptoms, realize that's not normal. Asthma should be completely under control. If you're having those frequent symptoms, you need to get back to your asthma specialist and go update your medications. When we're talking about treatment, there are, of course, two types of treatments. One is known as a controller medication. Think of that like toothpaste. You take it every day. You don't just stop using the toothpaste because, hey, I don't have a cavity at the moment. You understand that you need to take that every day, even when your asthma is feeling good, to keep it under control. The other one is to understand that you're using your rescue medication or your quick relief medication when you need it, and make sure you're using the right medicine and the right type of medicine at the right time. Make sure your child understands that too. Take this summer to make sure that they get that straight. Lastly, work through the summer on what your asthma action plan is. And by that, I mean, what is going to happen when you do start to have symptoms, when your child does start to have symptoms, and think through how you're going to handle that during this school year. One of the easiest ways I find to explain that to kids, which is very easy for us as adults to remember as well, is simply by looking at this pyramid. The base of the pyramid means all is good. We're in the green zone. We're maintaining and we're doing well. Next up, we're starting to have symptoms. If we're starting to have symptoms, think of that as the smoke to the fire. If you see the smoke, you know it can certainly blow into a big inferno, and that's when you need to get help. You're in the red zone. Don't wait and ignore the fact that you're having these increase in symptoms, shortness of breath, coughing and wheezing, that you've definitely moved out of the green zone into the yellow zone. Don't wait till you get all the way up to the red zone to then go do something about it. Recognize yellow zone means you're having symptoms and go do those appropriate actions in your asthma plan. If you don't have an asthma plan, this summer is the time to go get that figured out. So how do you know if your student is in control? How does your student know that they're in control? And I'm really a big proponent of having your child be part of this conversation. Even if they're in kindergarten, they need to be able to keep track and be able to report to you what their symptoms are. So do you need to use that quick reliever medication that usually it's an albuterol medication more than twice a week? It's just twice a week. If you're needing to use that more than 2 times a week, then you've got to go get another medication to stay in control. Do you actually end up using more than 2 of those canisters of those quick reliever medications? more than 2 canisters in a year, if you're running to the pharmacy within just a few months, having to refill that, you know that you're using that medicine more than twice a week. So you need to go get, again, a controller type of medication. Do you or your student, obviously, wake up in the middle of the night because they're having those asthma symptoms? And you as parents know what this feels like. Your kid comes in and wakes you up, or you're woken up by their symptoms. So not only are they having symptoms at night, you're losing sleep at night, and it'll affect your day as well. That's a signal. Those symptoms are there. You're in the yellow zone. Go act on that now. If the answer to any of these questions is yes, please go see your asthma specialist and get that back under control. So I hope this was helpful, these network notes for parents and with allergies, asthma as you go back to school. And we've got some other videos, and I hope you go check them out too as well, so we can really make this a great start of the school year for 2020. Thank you.